Hi, I'm Dr. Richikasahayshukla. I'm the director of India IVF Clinic, and let us take further this topic on our fertility talk. So today let us discuss about hysteroscopy. So the role of hysteroscopy in IVF cycles and when and why we should do it. So coming to what is a hysteroscope, you just visualize yourself that you have got a room and that room is the womb. And in that room, you need to see what is inside. So you put a camera in that room and you're able to see it. So the hysteroscope is an elongated tube kind of thing with a camera in it, and that we put inside the uterus to have a panoramic view of the uterus so that we can increase the success rate or we can comment about your uterine cavity. So when basically we need a hysteroscopy, do we need to do it in all the cases? No, definitely not. There's no recommendation that we should do in all the cases undergoing IVF cycle. But definitely, if the ultrasound, which we do a 3D scan or a 2D scan, and if it's showing any defect, any pathological problems, or the patient is having recurrent implantation failure, recurrent abortions, in that there is no definitive diagnosis also. In those cases, we should definitely do a hysteroscopy. And what we can take out, what we can do during hysteroscopy, we can increase your cavity size of the uterus. We can increase by doing things, we can increase the blood supply going inside the uterus. Secondly, we can cure the defect that is present in the uterus, like if there is a septum there or something, we can definitely remove that defect so that it increases the chances of you having a live baby. Thirdly, if there is no problem also, we can do the endometrial biopsy and we can take the sample and we can send it for further diagnosis that what is the problem, why you are having this recurrent implantation failure or recurrent abortions. But nothing is 100% because it is medical science. But obviously that will take us more towards the diagnosis. So like coming to the crux, so basically hysteroscopy should not be done in all the patients, but it should be done whenever there is a definitive diagnosis, whenever we want to make a diagnosis or the patient has some recurrent history, and that will increase your chances of conception if you're having recurrent IVF failures. And also we usually send the tissue for biopsy, and we can do different kind of tests also on that endometrial tissue that you need to understand. It's not only the biopsy or the TB test that is done. There are different comprehensive panels that are done when the hysteroscopy is clubbed. So basically the hysteroscopy procedure, it doesn't target only one thing, but it will target many things together, and in crux it gives us an insight that what to do for the patient who is having these recurrent failures or pathological problems in the uterus. We care about you.